You've only got to walk on a transforming care ward and you just know that it's a transforming care ward because it's so much calmer and the nursing staff look much less stressed and in control of the ward area. We're concentrating now on dementia patients within our general acute ward areas, and quite often in the past these patients were perhaps cared in the older people's mental health wards, and now they're becoming more common within our wards. And our staff are now being equipped with this very specialised skills that are required to care for these patients. And it's all about understanding and knowing that patient and individualising the care for that patient.
One of the biggest pieces of work that has come out of that under the patient-centred care stuff is the This Is Me leaflet, which has been very, very successful in terms of focusing the staff's attention on the patients, not just the patient's physical needs, but the patient's emotional needs and psychological needs as far as their dementia is concerned. And the This Is Me leaflet asks questions like, what are your hobbies, where did you used to live, and asks questions about that individual as a person. So it enables the nursing staff to connect with them slightly differently, I think, to maybe what they would have without it.
And we have had some very positive feedback from carers saying that at least now they feel that people are actually listening to the needs of their loved ones.
With handovers, basically what the nursing staff did, they videoed the process as it was at the time. We then sat down with a small group of the nursing staff, played that video back to them, and then process mapped the handover process. The nursing staff then made a decision on how they felt they could improve the handover process.
Before, when we used to have handovers, you'd be in there for about 45 minutes. They would tell us everything that was going on, things that we didn't have to know about.
It helped a lot. It cut our handover down to half. Now we're getting all the relevant information and it's all consistent. Then we've got more time with our patients and all the information is all on our handover sheets.
It's quicker now because they're just basically saying what they need for us to know with the patients.
And also by introducing the patient status board as the focus for the handover, it made the handovers much shorter in time, but far better in terms of quality of information given about each patient. The patient status board reduces interruptions to nursing staff because, as you can see from this board, clearly indicates what's happening with the patients, which means that any multidisciplinary team member, medic, therapist, can come and can see what's happening with the patients and therefore not have to interrupt nursing staff while they're caring for the patients.
That's what's been very powerful for me with Transforming Care. When it's worked within a ward area, you can see the culture and change. It's not just the ward sister or charge nurse setting the standard of care, it's the whole team. Catering staff, the nursing team, the medical staff, the therapy staff. It's a whole team approach, and that then you get a shift in culture when everybody's working together with the same common aim.